Managing COVID in a low trust society, evidence from France is the title of the next one. This is to relate to fieldwork I've been carrying out over the last few months in France, and in particular in one French region, Auvergne-Rhône-Alpes. I carried out interviews with 4 types of stakeholders. Now, hospitals were in the forefront in the front line of COVID, so evidence was gathered via interviews with medical practitioners. Very, very interesting, based mainly on the recollection of the early months of the pandemic. Secondly, local politicians were very important. They were faced with the immediate consequences of the pandemic outbreak, and so evidence was gathered from the city of Lyon, from the Ardèche Departmental Council, from the Auvergne-Rhône-Alpes region, from the mayors of several small communes, including in the city of Clermont-Ferrand. State institutions were far removed, but exercised an overbearing regulatory weight in the case of France. And the panel captured relationships with various institutions, notably the regional health agencies. Associations were also important. They were integrated into the analysis. And finally, academic research mobilized a mass of material since the onset of the pandemic. And so I interviewed various senior and junior scholars in the universities in the Auvergne-Rhône-Alpes region. And collectively, these distinct perspectives allow us to rise up the ladder of generality and to say something general about how the COVID-19 pandemic was experienced in a particular region. There's also a survey going on, but I'm just going to talk about my interviews here. Because, of course, COVID-19 was a global challenge, but policy responses varied to it across time and place. Hence the importance of drilling down into into precise interviews in particular places, because they allow us to understand how the pandemic played itself out in particular regions. Not necessarily the same experience was held in other regions in France. Now, I chose France because France is sometimes deemed to be a low trust society. People are rather suspicious of government, and interactions in civil society are sometimes a bit limited. Now, if we take the Auvergne-Rhône-Alpes region, our interviews sought to capture these different perspectives from health professionals, local and regional politicians, associations, firms. And I propose a typology for understanding COVID-19 based on the types of responses. I call these libertarians, preventives, agnostics, and learners. But what strikes most observers of France is that President Macron, the French president, adopted a very interventionist style. He promised to spend whatever it would take in order to successfully manage the pandemic, and did manage by and large to keep the social peace in France, which is not the case everywhere, although clearly contributing to France's longer-term budgetary challenge. And the French case, interestingly enough, suggests that an existential health crisis can suspend the more routine politics of mistrust, that there is a degree of rallying to the government, rallying to the flag in a way, in spite of an underlying sort of system of mistrust. There was a definite rallying in a sense to the government. Now we asked 3 main trust-related sorts of questions in our interviews, and we were particularly interested, just in summary, we were interested in the effectiveness of wearing masks, attitudes to vaccination, compliance with the health path. Now, these issues, in summary, all raise issues of the benevolence of public authorities, their competence and their sincerity. And to conclude on the French case, I think we can say that in a very, very difficult pandemic, France nonetheless managed to find its way, managed to keep the social peace, and the pandemic record at the end of the period was certainly an honourable one, in summary.